Hello and welcome. Is the year 2020 the worst year ever? Some disagree by reviewing happenings in the year 536 AD, the year of the volcanic eruption and dimming of the sun for about half a year in Iceland. Some argue that 1918, the year of the Spanish flu, trumps 2020. The arguments about the year 2020 could continue, but largely because of the COVID-19 pandemic, the lives of global citizens have been upended with nose masks, physical distancing, job losses, protracted closure of schools, and many more. How well have we dealt with this global health emergency in Nigeria, and what are the lessons to be taken home? Welcome to Fireworks on TVC. I am Bukola Samuel Wemimo. Let's take a break. We'll be right back. We're glad you could join us on today's edition of Fireworks on TVC News. My guest on the program today is the Director General of the Nigeria Institute of Medical Research, NIMR, Professor Babatunde Salako. You're welcome to the program, sir.
Thank you very much for having me.
You're welcome to the program. After witnessing record lows in COVID numbers between the months of September and October, cases are beginning to go up again. Is this the second wave that has always been talked about? And what are the factors fueling it, Prof?
Well, the issue of second wave for COVID-19 pandemic in Nigeria is not clear yet. Why did I say so? Ordinarily, to have a second wave, we should have cases dropped to single digits all over the country. Although we were beginning to record low figures of rate of infection, and I think at some point we had recorded single digits in some states, but overall we were yet to record single digits. However, we had the issue of NSAS, and there were a lot of crowd coming together, jettisoning the NPI instructions. Social distances was disregarded. The use of sanitizers and face masks went to the BRS minimum. And thereafter, we began to see increase in the number of cases of COVID-19. So I thought that we might be seeing that response really may be coming from that disorganization in the social gathering that we had, and that a lot of people were passing the infection at that point. That may be one possibility. Of course, the other possibility is a second wave, which I said we needed to have the country recording single digits in the number of cases of COVID-19. Naturally, pandemics like this will run that kind of course, because when lockdowns were pronounced and activities against COVID-19 was heightened, everybody was afraid. They were using face masks, hand washing, sanitizers, all of that. Cases will drop. But then as soon as we are off our guard, it is very likely that people then jettison the social distancing instructions, and then infection starts to rise again. That usually is what brings about the second wave.
The factors you talk about regardless, Professor, single digit, even if Nigeria began to experience single digit, would it be a true reflection of the situation of things because of another factor itself, which is lack of testing per population in Nigeria?
Well, yes, we can say that we are not testing enough, but you see that it's the same platform of not testing enough that we were seeing hundreds of cases before. So if in the same platform we're beginning to see low figures, then it is telling us something. Maybe not exactly what is happening, but at least there is a reflection that the cases were dropping. And so we cannot blame all of that on the fact that we're not doing enough tests.
So let's tackle testing headlong now. In NCDC's report for November the 17th to 24th, 1,794 tests had been conducted that week. This appears a significantly low number compared with testing capacities of other countries, even in Africa. As at October, Kenya had done 500 and something thousand tests. But in November, Nigeria is still at a little over 700 and something thousand tests. What, in your own view, are the limitations to testing?
The laboratories that are used for testing require very robust equipment and, of course, technical know-how and a lot of training for those who would use such equipment. And we do not have many of such within the country. That's one. Two is that there has to be materials for testing. The test kits, the RNA extraction kits, which have to be bought. And this will depend on how much money is available to government to do this. Although there are a lot of development partners and countries that are donating such test kits and RNA kits to the country, which the NCDC has judiciously distributed to the existing laboratories that we have. However, we still do not have these laboratories everywhere we should have them within country. Most of them are centered in the cities and some bigger towns. But when you look at the rural areas, the hinterlands, those tests are not available there. And so we are not covering a lot of people. More importantly is that we are not using rapid kit tests yet. Now, if we decide to use that, then that will be available to a lot more people than we are having now. Of course, the other factors is that Nigerians themselves don't see COVID-19 as a serious issue any longer. And you notice a lot of people don't look at social distance as important anymore. Many people don't use face masks. They don't use hand sanitizer. We don't even know if hand washing has not disappeared, even though we see constructions and in many public places that has opportunities for hand washing. You don't see people there any longer. So these are the reasons why you don't find people going for tests unless those who are sick and those who are traveling either out of Nigeria or coming to Nigeria.
I'm glad you have talked about attitudes. That's where I'm headed, because we have also interviewed the Director General of the PTF on COVID-19, and he said to us just months back that attitudes to testing was one of the limitations to testing. Do you perhaps think that this has to do with the distrust for the process itself? Because at the onset of the pandemic, there are many who spoke to pressmen off camera that they went to the hospitals to complain about malaria symptoms, and their cases were presented as COVID in suspicion of the intention to push up the numbers. What are your thoughts on this?
Well, I think that is ignorance because COVID-19 symptoms are like malaria symptoms in most cases, like the common cold symptoms. So they look like the normal thing Nigerians are used to when they say they are sick.
But what about cases where they had not been tested, yet their cases were presented as COVID?
You see, physicians or healthcare workers who see them are familiar with the little differences between these supposed malaria cases and COVID-19 symptoms. And there are some peculiar symptoms that they may have that may make the physician think that rather than this being a malaria, it's more likely to be COVID-19 infection. So that decision is in the hands of the physicians, and they, as patients, may not be able to know if their case was malaria or was COVID-19. So it borders more a little on the general knowledge of malaria symptoms, which has been with us over many decades, that we are used to. And we think that, therefore, this is malaria and not COVID-19. I think more importantly is the fact that when you look at what happens in the US and Europe, there are a lot of morbidity, mortality, a lot of people are sick, and a lot of people died. The hospitals couldn't take patients because of many cases. And people thought that the case for Africa would be worse than that. Surprisingly, we didn't respond like that. So people felt that, no, this couldn't be the same disease that was killing people in America, for example, and now in Africa, that we didn't respond like that. So they didn't think we had COVID-19. They believed that it doesn't exist just because of that. Whereas there were other issues.
So can a medical practitioner present a result without proof of diagnosis just because the cases appear similar?
Medical practitioners are trained to look at clinical symptoms and examination to determine the presence or absence of disease. Now, investigations are done to confirm that suspicion. So it's not the result that we often treat, but we treat the disease with the experience that the physician has. And in such situation, the patient's concern may not believe the physician.
Okay, so we'll accept your explanation. Prof, now, we're still with testing. Nigeria has 61 molecular laboratories, and I'm glad you touched on the lack of technical know-how moments ago. If they were filling the gaps in accessibility and affordability, how do you explain reports from Ogun State that some parents of pupils in private schools protested government's requirement that returning pupils should undergo COVID-19 tests with the cost of 25,000 naira attached? Although I must add this, that the NCDC had clarified that tests in those laboratories, in the 61 laboratories, were free. So if they were free, how come they were not meeting this accessibility and affordability gap?
Well, government laboratories for COVID-19 tests have always been free. And for students who are going to go back to school, they are going to be mixing in the class, no matter how much social distance created in the class. When they go out for break or go out to do other things within their schools, they will mix naturally. So it becomes necessary that they have an idea of the status of each of the students before they come into the school premises. However, we have now private sector involvement in testing because the government laboratories alone may not be able to have capacity for testing all those who may want to get tested in Nigeria, removing attitude from it. So the private sector laboratories have come to fill that gap. And I think asking them to pay, it may mean that it's one of the private laboratories that will be doing this test. Having said that, I am not aware that there is any of the government laboratories that are not open to people if they want to do the test.
But it still begs the question, and I'm glad again that you talk about partnerships with international organizations for testing. In Ogun State, there is a partnership with international organization for drive-by testing. So we're not necessarily talking about a remote part of the country. So why, again, are government laboratories not meeting this accessibility gap in the problem of testing?
Okay, I think perhaps what we do not understand is that there's a difference between the laboratories that carry out the tests and then the centers that take the samples. Government laboratories only carry out the tests when they see the sample. Now, where the samples are taken are usually in the hospitals, in the drive-through center. We have a drive-through center in Yaba here, which has been functioning since March 30th, and it's been free, and people have been coming. And these days, the number of people that we see have gone down a little. Although government was concerned about we doing tests for those who are traveling, rather than for those who want to go back to school or who are sick, who actually needed the tests to be done. So making a drive-through test available in Ogun State is perhaps Ogun State government decision, a way to make the test available to people. But when samples are taken at those drive-through, the samples are not processed in that place. They were in fact taken back to the NCDC laboratories, where the samples are now tested to confirm if the patients are or the people have COVID-19 or not. So the other way they will take it is to take it to private laboratories if people are willing to pay, because there are people who may not want to come to drive through, for example. I mean, some of the elites may not want to go there. They may want something private for themselves. So this is why we have some of these private facilities to take care of that.
Can we rule out the possibility of the challenge of lack of technical know-how that you mentioned earlier to be at play in this particular situation?
That will be for increasing the number of laboratories in Nigeria. But for existing laboratories, the people have been trained. And it doesn't take long if they establish a new laboratory today to train people to be able to use it, because they are not starting from ground zero. There are people who have experience in the field. And so it shouldn't take long for them to learn the process of carrying out the tests.
We'll stay with testing, but that will be after the break, when we'll now talk about the efforts of Nigeria Institute of Medical Research in the area of manufacturing locally made test kits. Stay with Fireworks. We'll be right back.